Welcome, welcome, welcome. I'm Sky Houston with Magic 102.1. Super excited. I'm always excited to have great conversations that's going to lend information, helpful information and resources to our listeners, to our viewers who may join us virtually. And on today, happy to have Dr. Andrea Alexander here. Now, is it Andrea or Andrea?
It's Andrea, but you know, where I come from, people call me Andrea, Drea, Dre, a little bit, itty bitty. You can call me whatever floats your boat.
I'm going to call you Dr. A today.
That's perfectly fine. That's actually what everyone calls me at work. So perfect.
Awesome. Now tell us a little bit about yourself. Where are you from? And tell us about how long you've been in practice as an OBGYN.
Okay, so I am from the greatest city known to man. It is Houston.
Houston?
Yes. So I actually grew up listening to Magic 102.1. I grew up listening to Tom Joyner and Kandi Eastman, all that good stuff. So I'm a huge fan. And I graduated OBGYN residency in June of 2019. So I have been practicing by myself for the past 2 years almost.
Wonderful. That's good to know. And that makes this conversation for me even more exciting because as a new doctor, your viewpoint of what you're seeing coming in is fresh, and your take on it may be very different from someone who's, been in it 20 plus years. So let's start the conversation there. Today, we're discussing maternal health and how COVID-19 is affecting that process. And just share with us a little bit, what is going on currently in those regards?
So in regards to COVID-19 and pregnancy, the area where I have the most experience with that is just the fact that whenever women come in to give birth, we have a little bit more stricter guidelines, right? So you can only have one visitor at a time, and it varies from hospital, institution, whichever one that you're at. But typically, it's just one person. That person can't trade places with another person. Usually if you're coming in for an induction, you have to get screened prior to coming in. And of course, if you're positive, then you get placed inside of a positive pressure ventilation room. And we implement isolation precautions there. Of course, if pregnant women do get infected with the COVID-19 virus, then they are at increased risk for more exacerbated disease. So they're more likely to be put on a ventilator or on oxygen. They can be at increased risk for preterm birth and preterm delivery.
So, and with that being said, thank you for that information for those viewers who are tuned in. You yourself may be currently pregnant, or you may know a friend or family member who is expecting. Great information for you to be able to ease their mind on what they're going to experience when they go to the hospital, or should this be their scenario. And Dr. A, today, when you say a lot of these things that are going to be the norm during COVID-19. Is this across the board for everybody? And I'm asking that in terms of ethnicity or race. I previously had a conversation with the March of Dimes. We had this long panel discussion, very great discussion on just experiences that different ethnicity groups go through, what the experience is like one to the other. And would you say in your experience over the last 2 years, things have been even keel, or are there any disparities that you yourself have identified?
Right. Well, when I was in private practice, the majority of my patients were Black and brown individuals. So I had the pleasure of, servicing those individuals. And then when I moved more so into hospitalist medicine, which is basically just covering the hospitals and the ER with OBGYN, I'm still servicing mainly Black and brown individuals. But even during my time in residency and in medical school, I do notice, the other side of things where you unfortunately see stereotyping. You see inequitable care being delivered to Black and brown individuals. So I would say that things aren't equal in blunt terms.
Yeah. it's still hard to believe in 2021, but considering the landscape of things that we've seen in this past year, nothing is unbelievable. But what I would like to ask you, in your viewpoint, how can people of color, women of color, what can they do about it, or how can they sort of address racism in healthcare if there's anything that can be done?
Right. So, I think, first and foremost, I got to address the elephant in the room. I hate that it's always a burden placed on our shoulders to feel like we have to do something to change the implicit bias that's inevitable in medicine. It's a lot to take on, and that's a lot to think about as a patient. It can cause a lot of anxiety and stress, and I get it. Like it's so frustrating to think that, okay, this isn't my job. It's not my job to treat people or to look past the bias. And still we have to take it upon ourselves to show that we're educated, and even if we're not educated, we have to show that we're still human beings and that I should be treated as such. So I get it, like there's frustration there, but even and so is it's not your job to undo bias in the medical system. I do think it's important to arm people with knowledge of what they can do, like you said. So using buzz phrases like, hey, I'm concerned. Like whenever you use the word concerned, that right there, it makes, doctors' ears perk up. So saying, I'm concerned that something is wrong with my health, or I'm concerned that if I go home or if I'm discharged, that something else will happen. Or saying, hey, listen, I'm a little worried. Can you watch me overnight? Because I live far from the hospital. And if I go home, I won't have a ride back. And if I do have a ride back, it takes like 40 minutes to get here. So saying things like that can really make doctors' ears perk up. If you have any family members that are doctors, nurses, PAs, physician's assistants, physical therapists, I always tell them, let them know that in a roundabout way, because I actually just came from an urgent care clinic with my mom. She's fine. And I feel like whenever I mention, hey, I'm a physician and I'm concerned about her because she never complains about pain, I immediately feel like the doctor started to listen. So I definitely encourage patients to let them know that. And you don't have to say like, well, my sister's a nurse. You can say, hey, I like your scrubs. My sister's a nurse. Where did you get them? So I can buy her some. Or how do you like being a nurse? My sister's a nurse, or my friend is a nurse. And, like I always try to tell them, like, let them know, because if something's going wrong, they know you have a contact that you can, connect with to see if that plan of care is right or if it's a little bit off. So definitely let them know that. But definitely those are the two main things that I try to tell patients. And then lastly, I try to tell them to let them know that you're paying attention. So if they're hanging a med, say, hey, what med is that you're hanging? Or they take your blood pressure or your temperature and say, oh, okay, so that's normal, right? Like just let them know that you're paying attention to your surroundings, so they can't just come in and do anything and expect that you're not going to ask questions about your care.
That's really good. Very good suggestion. I just thought about, as you were explaining those few things that, women can do. Mm-hmm. How do you even know if you're going to get care? You're assuming you're going to get what's, proper care. How do you even recognize if you're suffering or going through bias? Like, what are some signs to look for if these things are happening? They could be taking you for granted, that you're not even going to know that this is happening. What are things that women can look for?
Mm-hmm. Right. So the best way to do that, again, is to arm yourself. And I know it's like, I don't want to study any more information. I'm in another field, or I'm grown, I have kids, I don't have time to, look up certain information. But really arming yourself with the knowledge of, what's going on in your body is going to be a good option. So for example, in my respective field with OBGYN, I tell my patients, look, these are the reasons why you would not be able to get in an epidural. And I also discuss it in my ebook. So if you have the team coming in telling you you can't get an epidural and it's none of those things on the list, that's a problem, because Black women are 22% less likely to get pain medications in labor. So things like that. Or I try to tell them, these are the reasons why you would have a C-section. So if they're telling you that you need one and you don't see the reason, there, then that's a red flag, right? Really trying to connect with your family and friends if they're in the medical field. I mean, they don't have to be a doctor. Like, even if they're in the vicinity of a hospital, sometimes, healthcare workers are smart, like we get into our routines and treatment plans. And so, even like my scrub tech will know, what the plan of action is. Like, she can look and tell what the course of action is going to be for a particular patient. So, even if your family member or friend isn't a doctor, get in touch with them. Like, hey, something just doesn't feel right about this treatment plan or this plan of care. Does this sound right to you? Do you have any like knowledge or anything like that? And then going with your intuition. I mean, women especially, we have great intuition. So if something doesn't sound right to you, then ask that question to your physician. I mean, that's what we're there for, right? And I realized, as being a doctor, it does, take a little bit of time to address more questions that your patients have, but hey, that's what we're there for, right? So
Yeah, absolutely.
yeah.
I shared when I spoke before with the March of Dimes, my experience when had gone through labor. I had to get an emergency C-section, and I had to get an epidural. I already knew I wanted one, but the time in which it was applied or inserted was, the thing. So I recall telling the nurse who was doing my epidural, like, it doesn't seem like it's working. I feel everything. I'm experiencing this pain. I can feel the contractions, and they were about to take me into surgery. So I kept letting her know I'm feeling all of this. And she kept telling me, no, you shouldn't be feeling anything. And I had to literally argue her down for her to do it again so that I could be painless, numb. So my question is, how implicit is it? Do people really recognize when they're being biased, or is it, sometimes maybe it isn't biased, maybe someone really doesn't know? Like, what are the percentages, do you think, when it comes to awareness?
Mm-hmm. Well, I don't know the exact number of how many, Black people feel implicit bias, or how many doctors who are not Black, have some sort of implicit bias scenario. So I definitely don't know the numbers for that, but I do know, as far as Black maternal mortality, Black women are 3 to 5 times more likely to die, especially from preeclampsia and blood clots. Like in the white community, white women are typically, they have, a 14.7% chance of dying from, I erased that. Out of 100,000 live births, white women can die 14.7 times, whereas in the Black community, that number jumps to 37, right? So that's about already 3 times as likely to die. But we know whenever you're growing up Black and just going through life as I hate saying the word minority, but for your audience's purposes, as a minority, you can feel when people are being racist towards you and when they're not listening, or when their bias is carrying over into their treatment plan. So, no matter what the percentages are, it's there and it's real. And I'm sure you felt it whenever you were going through your emergency C-section, for sure.
And that was the thing. I didn't know what it was till later on. I'm hearing all these statistics about the experience of the Black woman. And I'm like, wow, that's what I felt like. So it was way after the fact that I was made aware of what was really going on. So I'm just thinking about the many women who go into labor or to the doctor's office for services, and you just have no clue until, like, I used to get told, I got these rose-colored glasses on because I go in with the best mind that everyone is everyone,
Right.
So this is a great conversation to get our listeners thinking about, what is your experience? How can you go in more knowledgeable? What are the resources you have? So I'm appreciative of you, Dr. A, coming on today, sharing some quick tips with us. Let our listeners know if they ever had a question, or where could they find you?
Sure. I am online. My website is pagingdrdre.com. It's pagingdre.com. And then on Instagram, I'm paging.dr.dre.
Wonderful. Dr. Dre, it's not hard for us to forget that one. So
Yeah.
thank you again. We look forward to just getting more information and sharing it amongst ourselves as we support and undergird moms, all moms, and then especially moms of color dealing with the things we go through. So thanks again, listeners. If you enjoyed this conversation and you want to keep the conversation going, please send us a note, a comment, and be sure to share this with your friends and family, whether it's by letting them see this video or just share what you caught today. More is caught than is taught. So we thank you again. Dr. A, we wish you well and we appreciate you on today. Thank you.
Thank you so much.
Bye-bye. Thank
Bye.
you.